Have you been told that one of your fallopian tubes is blocked? Maybe you have been trying to get pregnant for months and now you are worried because your HSG report says one tube is blocked. Now you are asking yourself, does this mean I can't get pregnant? The answer is not necessarily. In fact, many women with one blocked tube can still become pregnant. Let me show you how exactly. Now, this diagram is showing the female reproductive organs. These are the ovaries. These are the fallopian tubes. This is the cavity of the uterus. This is where the baby develops during pregnancy. This is the cervix. This is the vagina. It receives the penis during intercourse for deposition of semen. First, let's understand how pregnancy normally happens. Now, for pregnancy to happen, four things need to occur. First, an egg must be released from an ovary. Second, this egg must enter a fallopian tube. And third, sperm must swim from the vagina into the uterus, enter the fallopian tube to meet that egg for fertilization. And finally, the fertilized egg must travel into the uterus for implantation. So that is how pregnancy normally happens. Now let's talk about what happens when one tube is blocked. Let's imagine this tube is blocked. Many women see this on their HSG report and immediately think, that is it, I can't get pregnant. But let's look at what is actually happening. Even though this tube is blocked, this other tube is still open. If this ovary releases an egg and this open tube is healthy, sperm can still travel up into this tube, meet the egg, fertilization can occur and pregnancy can still happen. So the presence of one blocked tube does not automatically mean infertility. This is one of the most important things I want you to understand from this video. One blocked tube does not mean pregnancy is impossible. Now you may be wondering, but if I have only one working tube, won't my chances be reduced? The answer is sometimes yes, but it depends on several factors like your age, how regularly you ovulate, the health of the remaining tube, and sperm quality. If the remaining tube is healthy and everything else is normal, many women are still able to conceive naturally. Now, let's discuss something that confuses people. Some women ask, what if I ovulate from the side with the blocked tube? This is a very common question. Traditionally, we think of the egg being released from one ovary and entering the tube on the same side. But the female reproductive system is not always that simple. There are cases where the open tube may pick up an egg from the opposite ovary. So pregnancy can sometimes occur even when ovulation happens on the side of the blocked tube. However, this is not something we can predict or rely upon. The most important thing is whether there is at least one healthy functioning tube available. Now let's talk briefly about the HSG test. An HSG or hysterosalpingogram is a test used to check whether the fallopian tubes are open. During the procedure, dye is injected through the cervix into the uterus. The dye then travels through the tubes. If the dye flows out of the tubes here, the tube is considered open. If the dye cannot pass through, the tube may be blocked. This is how many women discover they have a blocked tube. But there is something else you should know. Not every apparent blockage on an HSG represents a true blockage. Sometimes the tube can go into spasm during the procedure. When that happens, the dye may not pass through even though the tube is actually open. This is one reason why your doctor may sometimes recommend additional evaluation depending on the situation. Now let's discuss when a blocked tube becomes more concerning. If both tubes are blocked, natural conception becomes much more difficult. If there is severe damage to the tubes, fertility may be affected. And if a condition called hydrosalpinx is present, special treatment may sometimes be needed before fertility treatments. So the significance of a blocked tube depends on the overall picture. The key message I want you to remember is this. One blocked tube does not automatically mean you cannot get pregnant. Many women with one blocked tube conceive naturally. The most important question is whether the remaining tube is healthy and functioning properly. So if your HSG report says one tube is blocked, don't panic. It is important information, but it is not the same thing as being told that pregnancy is impossible. If you have been trying to conceive, speak with your doctor about your individual situation and the next best steps. And remember, one blocked tube is not the end of the story. Pregnancy may still be possible. Before I end this video, remember that fertility is really about just one factor. One blocked tube may affect fertility, but so can ovulation problems, age, and even sperm quality. In fact, one of the most common fertility tests couples must do is a semen analysis. If you have ever looked at a semen analysis report and wondered what all those numbers mean, I have made a video explaining every important parameter in simple language. I will put that video on your screen right now. I will see you on that video. And until then, stay healthy and be kind to yourself.